everyone, welcome back to Function Pilates channel. I'm here to do another postural therapy workout with you. Postural therapy is a form of corrective exercises to help regain better posture in the body. It helps to realign the spine and helps to reduce chronic pain in the body. It also helps to accelerate any recovery you have coming off from an injury. So we're going to go ahead and get started. I'm right up against a wall here, so you can find a free space in your own home. And what we're going to do is we're going to start lying down on your back, and we're going to place our feet against the wall here so that we are positioning our knees at a 90-degree angle. Okay, so what we're doing is just getting the body into a horizontal position so that we can regain all the natural curves of our spine here. And I'm just going to have you guys start lying in this position, trying to relax your shoulders down and away from your ears, trying to soften through your jaw. Go ahead and close your eyes to soften through those facial muscles. And just focusing in on your breath as you take those inhales through the nose and long exhalations out from the mouth. Again, just focusing on taking those deep inhales through the nose, letting that air go way past your chest and down deep into your belly. Notice how your ribs get to expand as you take that breath in. And the ribs pull back together as you take the exhale out. Just practicing our breath technique here can already help to reduce stress that you may carry around in your shoulders or in your neck. So focusing on a little bit of breathing every single day completely helps our body and our mind. So what we're doing here is this exercise has a name. It's called static back, and you can lie here for 5 minutes. You can lie here for 10. It could be 20. So I would suggest taking at least 5 minutes of your day to start with this. It could be with feet up against the wall, or we can even prop our legs up on top of like an ottoman or a chair or any other piece of furniture around your house. But for time's sake today, we're going to begin. I'm going to have you start by interlacing those hands together. Thumbs are side by side. We're going to relax the shoulders down away from the ears. Drop the chin down to elongate the neck and begin to reach those arms behind you. Our goal is to touch the floor. If you don't touch the floor today, that's okay, because the idea is to have the elbows completely straight, and if you feel like they want to bend on you, then you've hit your stopping point. So let me show you an example. If you are feeling your elbows begin to bend here, this would be your stopping point, because we do want the arms to stay straight. Then you would return back to the top here. Wrists are going to stay over the shoulders, and then we're going to begin to bring those arms behind us to frame the ears, and again with the goal of touching the floor. So we're going to repeat that. Just again, we're letting our back relax. If there's a little bit of an overarch there, that's okay. I want you to really focus on getting this stretch behind the back of the shoulders. And for those that feel it in their upper back, getting that full stretch there as well. And let's go ahead and return back to the top here and down beside you. Okay, we're going to go back to that because I'm going to do 3 sets of 10 on that. So from here, I'm going to have you glance up, making sure that the feet are in alignment. They're parallel. The knees are in line with your ankles, and the knees are in line with your hips. Okay, so From this position, palms are up to open up wide through the shoulders. We're going to begin to turn those knees towards one another. And then you're going to roll on the outside of your feet to open the knees apart. We're going to go ahead and pull those knees back together. And you're going to begin to pull those knees apart. So because of the movement of the feet against the wall, there might be a little bit of shifting. So just double check to make sure that things are staying in proper placement. And we're rolling out from our hips. Again, just focus on a comfortable breath pattern for yourself. And what this is doing is it's helping to realign the pelvis, realign the hips here. And our goal is to focus on symmetry. So what does that mean? Well, are the knees, if you glance up, are the knees opening up equally left and right here? Or does one have the capability to open up further than the other? Maybe you're recovering from an injury, so you don't have that full range of motion just yet. And we're going to take it back one more time, returning through the center. Good. Let's hold it right there. Interlace those hands back up at the top. Thumbs are side by side. Let's repeat. So take notation here if you are able to go a little further than the previous time. If for some reason you have trouble keeping those arms outside of your head, outside of your ears, you can always place a book in between the palms of your hands to widen the distance. And these are pullover presses, so like I said, they're helping to create flexibility in the shoulder and to provide a stretch there through the back and the back of the shoulders. 4 more. Another option here, if you are having a difficult time tapping the floor, you can always place a book on the floor and let that be your point of contact. So we're just bringing the floor up to meet your hands. 1 more time. And then return up to the top here. Let's relax those arms down beside us again. Palms are up. Going back into these adductor presses and open out to the side. We're rolling. Roll the knees together. Roll the knees apart. Rolling them together. Roll it apart. Nice. And take it again for 5, 4, 3, 2, and 1. Good. Realign back to that parallel positioning. Last time with the shoulder pullovers here. So interlace those hands and bring those arms back. And by this time for me, it does feel a lot easier than it did the first time around. I do feel like I have more range of motion, and hopefully you do too. And up. So because it feels easier, it's almost like gravity wants to pull my arms down a little quicker. So just be mindful that you're staying in control of this technique. Five more here. Good. 3 more. Reaching long. 2. Again, paying attention to that the elbows are staying straight, because we do forget last time. And then return back up. Perfect. Our 3 sets of 10 are done there. We're going to finish it with one more set of 10 here. So again, knees are coming together, and then we begin to open it up. Good. How is this feeling for you? How is it feeling through your hips? Do you feel like you have increased range of motion than the first time you started? Because a lot of the times once we begin, those few first 5 to 10 feel a little sticky, feel a little rough. Good. And open out and close. We have 5 more. And 4. 3. 2. Good. One more time. Awesome. Great. All right, let's roll it off to the side, and then we're going to go ahead and come up into all fours position. So if you need to get any pillows underneath your knees, I would suggest that here. All right, let's go into some cat stretches. So we're going to drop the chin, round out through the spine. Good. So what I'd like you to think about here is that your shoulders are over the wrists and the knees are directly underneath the hips here. Let's go ahead and lengthen out. Exhale, push away from the floor to round the spine. And then lengthening out, lift the chest. Good. Draw it up and return. Nice and easy. We're going to just do a full 10 here. So let's go for 5. Now, if there is a position of this that feels better to you, maybe it's the extension phase, maybe it's here, then I would recommend that you stay there a little longer. If it's here, think of pushing the floor away to open up through the back of the shoulder blades. Good. 3 more. And lengthen out. And 2. And lengthen out. Good. One more time. And let's return through center. Perfect. So we're going to stay here and we're going to go into thread the needle. So I'm going to have you guys take one arm out to the side. You're going to slip it underneath your left armpit. You're going to bend into your left elbow quite a lot, and then you're going to rest your ear down towards the floor. If you need to place a pillow underneath your head, I would suggest you do that so that you can be propped up a little bit if you can't reach your ear to the floor. And stretching those right fingertips out from underneath. Think of stretching back the shoulder again. And just breathe. Good job. Again, if any of these feel better to you to stay longer, you can definitely stay longer in these static positions. Carefully, we're going to come out of that, and you're going to reset yourself up, and we'll do the other side. So left arm out to the side, it's going to slip underneath, thread under this right armpit, stretching those fingertips forward. Good. And maybe one side feels a little bit different to you. So if it feels a little bit more uncomfortable on one side and you need to prop up on a pillow, that's completely fine. Again, just taking those breaths when you need them. And then super slow, we're going to come out of that position once again and return back up. Good. Okay, so we're going to find our way up into a nice tall standing position here. And we're going to line ourselves up about hip distance apart there with the feet. Okay, we're going to go into some shrugs here. So we're going to pinch those shoulder blades together. And then from here, you're going to lift your shoulders up to meet your ears, and you're going to lower them back down. So you're shrugging, you're contracting those muscle groups above your ear and lower it down. Good. So squeezing those shoulders up. Keep the pinch behind the back of the shoulder blades, lower down. Good. Lift and down. And they're actually more challenging than you would think, mainly because we do have to recognize that we are pinching through the shoulder blades the entire time and not letting that relax or get loose. Perfect. Lift up and down. Up and down. Good. 3 and 2. Good. One more time. And rest and relax it there. Good. So we're going to stay here. We're going to go into our standing windmill. So make sure we have plenty of space here. So hip distance apart there with the feet. Arms are out to the side like airplane wings. We're going to laterally side bend to the right. And then we're returning back through the top. Laterally side bend to the left. And return to the top. So things to keep in mind is that the hips and the body are not shifting with you. That this is really all occurring from the waist. You're shining those ribs up to the sky. You're sending the hips up to the sky as well. So think of the hips pointing in that direction, if that makes sense. And that way it'll help you enhance the stretch a little bit more. Good. And let's return back up. Let's come out into a little bit wider position there with the feet. Arms are again stretched out long, and we're going to side bend over. So for those who have scoliosis, for those who just feel like one side feels a lot tighter to them, and you'll know as you're going through these movements, this is going to be a really great exercise for you to go back to. Again, I love exercises where we can track our progress, and this is definitely one where you feel like you can track your progress. Again, try to avoid going too fast. And the main focus here is keeping those arms just pinned out to the side. It's so easy to want to lose that connection here and let those arms drop one more each way. And mainly because you probably can feel the heaviness through your shoulders and through your arms as you're going through this. Okay, so let's go into another wider stance here with the feet. So typically a position you wouldn't stand in. Let's take those arms right back out. Over to the right side first. And return through center. Over to the left. And return through center. Perfect. Now if you're getting any low back pain or discomfort here, think of tucking your tailbone underneath you to help support the low back. Good. And again, with postural therapy, it's a lot of functional movements here just to again regulate the proper biomechanics in the body. Simple things that you want to do in your daily life. So it may not feel like you're doing a whole lot here, but we really are. Good. And pause. We're going back to that very first position that we did, where we're hip distance apart there with the feet. Okay, arms up. This is the one where you're going to want to track your progress. Do you feel like you're going over further than you did in the very first round of windmills here? And I certainly do. Again, my right side is the one that feels tighter for me. So I feel like I just have a little bit more range of motion to dive deeper towards my midline here. And return 2 more each way. 4. And if it's not your favorite exercise, guys, then all the better. This is probably one that you do need. It's kind of a love it or hate it exercise, I will say that. And one more each way. And finish it to the left. And relax it there. Beautiful. Okay, we're going to go into inline gluteal contractions. What does that mean? Okay, I'm going to start back here. Inline meaning that we're going to focus a little bit about balance, okay? So we're going to make sure you have enough space so that we can walk. You're going to place one foot in front of the other. You're going to begin to contract, squeeze your butt cheeks together. So you're contracting your gluteal muscles. And then you're going to release as we step forward. Contract the gluteal muscles. Releasing to step forward. Contract. This is all about hip strengthening. Again, as we did our first exercise with the knees opening and closing, that was helping for realignment of the pelvis. So if you have any hip elevation, any hip rotation, that's what that's correcting. This is strengthening the muscles to keep those muscles, helping the bones to stay in contact there, to maintain that alignment. Good. Okay, I'm going to do another view from this way so you guys can see me. So again, we're going to place one foot in front. Contract with the glutes, standing tall, releasing, and squeeze and contract, and release. Standing tall, squeeze and contract, and release. So again, this is actually great because now we're challenging your balance. We're also challenging your coordination. Something so simple as this. Good. And you don't have to change it up, obviously. You can just go back and forth. I'm going to turn around. We'll go back this way. And think about doing, I would say, anywhere from 20 to about 60 of these. And it should feel good on your hips too, because we're just, again, we're contracting those glutes. We're strengthening through the hips. You might feel some cracks here and there. And then releasing here. Good. Okay, let's go ahead and we're going to come down to the floor. We're going to finish it with, actually before I get you on the floor, let's do a standing quad stretch here. So if you need to have something for balance, we can, again, use the wall piece of furniture at home, but we're going to take the left ankle, okay? You can prop your ankle against a piece of furniture, so you don't have to necessarily hold it like I am. You may not have that flexibility or the range of motion just yet, again, if you are recovering from an injury. So if we're here, I want you to notice that your knee is directly pointing down to the floor. You're staying squared with your hips, and you're lifting your chest up. So you want to try to avoid being in this position. You want to push your hips forward, and again, really feel the front of that thigh stretching here, okay? And just breathe nice and tall. So we just focused on strengthening through the glutes with our inline gluteal contractions. Now we're stretching the front of the thigh in the quadriceps here. So a lot of the times, if you are a person who has a tendency to walk in the ball of your feet, you have a lot of weight distribution in the ball of your feet, you're going to overly use your quads here, okay? All right, let's release that. About a 30 to 60 second hold. If you want to do longer, by all means, go for it. Let's grab a hold of the other side. Actually, from here, I'm going to show you this in a front view position here. So again, nice and tall. Let's keep the knees in line with one another. Tuck that tailbone under, push the hips forward. Try not to look down. I know it's hard to do, but try to keep your eyesight straight ahead, because when we look down, it makes us round our spine, and then we lose that straight connection here. Nice deep breathing. Again, just pointing the knee directly to the floor, maybe pulling your heel in towards your tailbone. Push your hips forward to enhance the stretch. Lots of different things that we can be doing. And We'll slowly release it right there. Very nice. Okay, now we're going to take it down to the floor here, guys. And we're going to go into our cobras to finish. So this is all about extension. I'm a huge fan of extension, mainly because we don't necessarily do it a whole lot. So let's take your feet out wide, nice separated. Hands are down to the floor. Eyesight is down to keep the neck in line with the rest of the spine. We're going to gently push our bodies off the ground. Okay, you're going up to your highest position here. Maybe it's not as high as this. And you're going to slowly lower and come right back down for me. So if you can only just hover to about right here, that's okay. Stay there. If you can come up higher, by all means, let's go for it. Lower back down. And press. Reach up. And releasing. Good. We're just going to do about 10 of these. Nothing too crazy. But it should feel like you're getting a low back stretch, a low back release here. If it's bothering your low back, think of opening up through your legs a little wider. And maybe just not coming up as high. You'll get there. 3. And 2. One more time. And coming right back down. All right. Let's go ahead. Take it into that child's pose if that feels good for you. Knees are wide. Reaching forward. Nice deep breath. Sink those hips down into the heels. And very carefully returning back up to the top. Again, guys, I hope you've enjoyed your postural therapy class today. Check out those other videos. There's a lot of different stuff in there that I do. You may find like the specific exercises that feel good for you, and you can just take 2 or 3 of those every day and work on your posture. All right, we'll see you next time.